Hello and welcome to Agents of Nonprofit. My name is Alexander Lapa, and I'm here to speak with everyday superheroes helping nonprofits. Today we're talking to Kristie Magee Porcaro from Operation Smile. Kristie, welcome to the show.
Thank you, Alex. Excited to be here.
So Operation Smile is quite a significant, quite a large, quite an all-encompassing, quite a impactful organization. I'm curious to begin the conversation with, how did this organization start?
Sure. So Operation Smile started in 1982, actually by my parents, Bill and Kathy Magee. They actually went on their first surgical program to the Philippines. It was a medical team. They were about 14 of them, and they were performing surgery on children with cleft lip and cleft palates. And at the end of the week, they had done about 50 surgeries, and the group of doctors that they were with at the time weren't going back. And they said to my parents, look, if you want to come back this next year and take care of these children, they will still be here. They may be a little bit older, but the need is great within the Philippines. And so my parents decided to go back. And just like the team before, they saw hundreds of children with gaping holes in their lip and their roof of their mouths. And they were really touched by the cause. And so really that's when Operation Smile was born. We like to say that it was built on passion and emotion and relationships. Fast forward 42 years later, we have over 6,000 medical volunteers. We're in 36 countries around the world. We've taken care of close to 400,000 children. But really, we drive every single day to educate and train more medical volunteers. We like to talk about it as an organization that is really locally driven and globally led. And that's what drives us every single day. So excited to be here. I grew up with this organization since I was 6 years old. So I really watched it over the last 40 years and 42 years transform and change, and just really excited to be here today to tell you a little bit more about my journey with Operation Smile and where we're headed and really how we're innovating for the future to take care of more children and families globally around the world.
I actually learned about cleft lips from your organization when I was a child, and I'm curious if you could just give a quick 30-second overview of what it is, why does it happen, and is it
Sure.
more predominant in certain parts of the world? And if so, do you know why? I'm just curious about the medical portion of this.
Sure. So cleft lip or cleft palate happens in the first 3 months of life when you're in utero. We as moms in developed world find out through an ultrasound. Sometimes in the undeveloped world, unfortunately, they don't find out till birth. We actually have one of the largest research studies in the world out at USC, where we're really studying the reason why children are born with cleft lips and cleft palates or cleft conditions. So what we have found is yes, it is a vitamin deficiency for sure. Sometimes moms don't absorb the vitamins, even though they're taking them. Also, the environment plays a big factor. What's coming off of these cook stoves that some families cook off of. And also there's a genetic factor. So there's kind of the vitamin and genetic factor on one side, and then how the environment plays a part. So, this organization is doing, like I said, one of the largest research studies around cleft conditions. We actually do a trio. We take swab samplings from the mother, the child, and the father, and really study the causes of clefts. So we're learning more and more every single day, but that's really why cleft conditions happen to our patients. Where in the world, actually, you'd be surprised, in the United States and other developed countries, there is about 1 in 750 to 1,000 children are born with clefts. In the developing world, we see about 1 in 500. So patients are just taken care of earlier in their life, in the developed world. But for us, it is a problem that does exist globally around the world. And a lot of our volunteers and medical professionals are those that take care of these children at an early age.
Just one more question about the medical aspect, because I am fascinated. is this a curable situation? Is if we were to be able to feed people, make sure they have the proper vitamins to set up their environment. Obviously, genetics we can't have so much control over, but if we were able to control the first two factors, reduce those factors, improve the factors, is this something that you could see at some point in the future disappearing altogether, or is it really something we'll have to mitigate for our entire species?
That's actually a really interesting question, Alex. What we're seeing is you can, the vitamins and that deficiency is going to be hard to get to some of these rural areas within the communities that we work. But through Operation Smile, one of our programs is through nutrition, and it is to teach the moms to eat the indigenous vegetables that exist that are high in folic acid and, vitamin B. The reality is that it probably will be something that faces us for a long time. I know that there is some surgery that they're working on, possibly down the road in utero, that they could fix maybe the cleft lip and or cleft palate in utero, but that's something that I think through research, needs more time to really evolve. But, we have billions of people all over the world. And so our job as an organization in the 36 countries is to educate the communities, the families on what it is important to eat. But the reality is cooking over open stoves and open fires is just something that is, a must for their survival in their communities and for them to be able to eat and stay warm. So there's a lot of factors that are coming off of these fires. We are trying to collaborate with other organizations around a cook stove project so that there's ventilation that goes out of the house rather than into the house that can cause, or we're seeing causes some of this cleft conditions.
Absolutely fascinating. Maybe I should have been a doctor in another lifetime. So for over 40 years now, I imagine that, and you must have seen it as you've been growing up as well, of course, is the organization has changed, evolved over time. Things, have changed in many different ways in many different parts of the world. I'm curious to know, how have you continued to evolve? How do you, it's a wonderful thing to see an organization continue for so long. What is at a high level, your secret sauce that allows you to keep on evolving?
Like I said in the very beginning, Operation Smile was built on relationships. 42 years ago, we started working within certain countries around the world. Now we're in 36. I think we've always been the innovators. We've always actually listened to the foundations and the communities where we work to understand what the need is. The fact is that there are 5 billion people that lack access to safe, affordable surgery. So for us, addressing the need of that scale requires bold innovation. Within the 36 countries that we work within, there are 5 million patients with cleft conditions. So for us, 40 years, 4 decades of history, we're really trying to embrace technology. We're really looking to implement and adapt training and education programs. It's going to be really important for us to make sure that there's a virtual component to some of the training that we do, which we do through the Operation Smile Academy. I also think that, we're really looking at supplies and equipment, because the reality is that the patients that are born with cleft conditions really live in the very, very rural communities. And for them, they have to walk the long journeys into these bigger cities to get support and to get surgery. So as an innovative organization, we're really trying to understand the need and go into those communities and partner with these hospitals to elevate safe surgery, to elevate care. Yes, around cleft conditions, but as an organization of 4 decades of knowledge, for us, if we train and we educate the big 5, so the doctor, the anesthesiologist, the nurse, the biomed tech, and the pediatrician, we can provide safe surgery on cleft conditions. But I often think about when Operation Smile isn't operating on children with cleft, what is the result of all these other surgeries that are being taken care of? They're being taken care of more safely because that training has happened. So for us, it's about evolving and changing and adapting with time. Even during the pandemic, we really relied on our foundations. They never stopped, even during the pandemic. They really went out into the more rural areas. I'll pick a country like Madagascar to make sure that all of our patients and our families had the right supplies and equipment to be safe. So 40 years of knowledge, really making sure that we understand and dig into what is lack of access of affordable surgery look like. And as an innovator, we want to provide that care closer to our patients and their homes so that they don't have to walk these long journeys to be turned away into the bigger cities.
You mentioned an academy, and you also mentioned that 6,000 medical volunteers. So I imagine you offer some kind of program to train them. Are these doctors already, and you train them very specifically for certain conditions for cleft in these regions? Or is it basically people who, like myself, who have no medical backgrounds, are able to get the training in that specific element and then be deployed?
No, so some of these are residents and these are medical professionals. So in the United States, you have a plastic surgeon, or a maxillofacial surgeon who does cleft surgery. In some of these countries, let's just take Rwanda, for example. In 2015, there were only 2 plastic surgeons for a country of about 16 million people.
Wow.
So you think about all those surgeries that they're providing. They're doing burn surgery. They're doing reconstructive surgery. They're doing surgery around cancer. They're doing bigger, surgeries that happen within their country. So as an organization, what we have done is really train that next generation of leaders. So last year, what we did is we started to train 3 of more surgeons within that country. So now they have 5. And by 2028, we will have an additional 6. So they do all surgery. For an organization like Operation Smile, what we do is we come in and provide the cleft surgery training and really making sure that we focus on quality. Not every one of the surgeons that does cleft would be credentialed by Operation Smile. So we have a standard of care. We really do, pride ourselves into not just doing surgery after surgery, but we pride ourselves in, if this were my child, would this be the result, or would this be the care that we provide? So we train surgeons, but we also make sure that all of the other cleft care team is also being trained. So like I said before, the anesthesia is probably one of the most important things that we provide, because that's when somebody goes under during surgery, and it's a really important skill. Pediatrics is also another important skill. Nursing is really throughout the hospital. So yes, around surgery, but also around, other divisions and units within a hospital. And then a biomed tech is really important, because what we've seen over 40 years is that sometimes equipment and supplies is just in the back of the hospital outside, and it's, not being kind of refurbished and used. So we train a biomed tech so that they can continue to service that equipment and supplies for safe surgery. So these are all the things that we've learned. Like I said, we really partner with hospitals, and it has to be the right hospital, and really making sure that volunteers that work with us are in those hospitals and that they work every single day. And when we come in, we'll do surgery, or they'll do surgery locally. But when we're not there, a lot of our volunteers do other types of surgery.
I imagine once they're finished their training, they get some kind of certification, and then they're able to do more than just cleft, right? You're augmenting their overall skills, cleft just being one of them. That makes sense.
Yeah. So yes, they're credentialed by Operation Smile. They graduate, just like any medical professional, they have to graduate and take boards, oral boards, plus written boards, but they're credentialed as a volunteer of Operation Smile.
I'm curious to know if there's any other programs you offer in this academy besides the training of these 5 individuals. Are there other types of programs that other people can participate in?
Yeah, so I think one of the biggest things that, and I'm so thankful for, our discussion is for people to understand that, yes, Operation Smile, has and always does surgery, but we provide so much more. I remember in 2007 when we did what was called the World Journey of Smiles, where we went around the world. One of the reasons why we did this audacious goal was really to start to talk about comprehensive care and multidisciplinary care. So when patients arrive, we have a foundation within every single one of our countries. And they get to see a speech pathologist, they get to see a nutritionist, they get to see a psychologist doing psychosocial. We work with the moms around breastfeeding. We look at dental, really important component of the surgery. Speech is really important because sometimes when you're born with a cleft palate, it's hard to eat or speak properly. So really making sure that our patients, when they're seen at the very beginning of their journey with us, they're also seen through 18 years old. So in the Operation Smile Academy, there's a virtual component of what we do, and it's an e-based learning. It's a remote mentorship service, and it's around all medical professionals around Operation Smile. So we have somebody who's teaching them how to do cleft surgery. We have someone who's teaching them around speech. Nursing is also, like I said, another really important component. Also making sure that, washing your hands and making sure that you learn how to brush your teeth properly. The nutrition factor is also really important. So there's so many components of Operation Smile that sometimes people don't know that we do, but on the ground in the work that we do, which is really, like I said, locally led, they provide all of this services to our patients and our family.
The technology element is obviously very interesting to me. You mentioned virtual courses and so forth, and then you were able to overcome COVID, let's say, to get through it. I'm curious to know, how important is technology in your organization, and how do you use it most, and which kinds of technologies you could even add to the conversation too?
Sure. Yes. I mean, I think, as an organization, we really, there's technology, of course, in the operating rooms that we work, really talking about capacity building, really making sure that we're achieving surgical excellence. So the equipment that we choose is really important. We partner with many companies, global companies out there. I will tell you that we're really looking at AI in a different way, just around patients and imagery and how do we perform that surgery. We actually partner with a company called Align Technology, where they donate scanners. And these scanners really help us because they're 3D scanners that look at the face in different dimensions in different ways. And we use that technology to really help us before surgery, during surgery, and after surgery. So innovation is something. We've also partnered with Microsoft around some AI. I'm really looking at how do we deliver safer care? How do we train our medical volunteers? How do we have the right supplies and equipment to do safe surgery? So partnerships are really important for us, making sure that they're cross-sectional collaborations that go on and that they're really supported on a local side.
So I love the AI element. 3D scanners are also awesome. What about 3D printers or certain learning management systems? I imagine that's all part of the mix as well.
Yeah, so we're really looking now as we look to the future and looking at technology in a different way. So we're in conversations with a lot of different companies, also around medical records. Sometimes it's hard, for our patients because they don't have the charts like we do, in the developed countries. So technology is something that we're really starting to expand and look at in a very unique way as we look at the next 40 years.
You mentioned partnerships. I imagine in order to be able to do what you do, you need to have some good ones, some corporate sponsorships, local sponsorships, and local partnerships. I'm curious if you could add a few comments about, how you work with, how you find partners, how you keep good partners, how you nurture those relationships, and how it allows you to do all this amazing work.
Yeah, I mean, I will tell you, It's been an incredible journey. I've been a part of Operation Smile, like I said, for 42 years, but officially for about 20. And, a lot of the emphasis and time is, for me, has been put into these corporate partnerships. It's really helped us move the needle in achieving global health equity. The partnerships and their expertise that they provide helped us in many ways through collaboration. But just to kind of talk about a couple, once Operation Smile partners with an organization, we really stay in partnership. And one of those companies would be Johnson & Johnson. We've partnered with them for over 35 years. They actually are one of our exclusive partners, where they provide us with all of the sutures for free globally around the world. Just recently, we got a donation of about $4 million of sutures from J&J, but that is just the beginning. We also work with about 35,000 of their employees. We've actually co-created, some technology with them. We also partner with their foundation. We partner with them on a global impact group, their global corporate equity team. We're one of their signature partners. So really cool, 35 years later, we're still doing some really innovative things together. We partner with Stryker, same thing. They've been a partner of ours for 30 years. They've really helped us train healthcare providers, within these communities. They've helped us advance and look at our operating rooms in a unique way globally. Align Technology, I told you about the scanners, but they also have invested in what we're calling one of our signature initiatives called youth empowerment. Operation Smile has always brought students on all of our surgical programs. And we always say, if you can inspire someone at a young age, think about the work that they do for the world, when they get a little older. So Align has invested in scholarships for some of our countries through visas, through tickets where they would never have the opportunity to come to the United States or another country. They've also invested in what's called the Cleft Connect community, where there are patients around the world that get together and really talk about what it's like to be born with a cleft lip and cleft palate and all the challenges that they go through. And then Baxter has also been another incredible partner of ours that has really worked with us in India, really making sure that surgery is more accessible to patients, in these rural communities. But the list kind of goes on. And like I said, partnerships are really important, even through cross-sector collaboration. So we partner with COSEXA, which is another critical pillar for us. COSEXA is the College of Surgeons of East, Central, and Southern Africa, and they've really helped us to strengthen health systems and increase global health equity. They've partnered with us to train more plastic surgeons and reconstructive surgeons, and in Africa and sub-Saharan Africa. So partnerships we wouldn't survive without them, and it really is trying to find the best of what companies do. Of other NGOs, we partner with a lot of other NGOs out there that don't do the work that we do to elevate the health system within the communities that we work. So I can't talk enough about it. It really makes me proud of the companies and what they do, but also in other organizations out there that just do incredible work. And it's about collaboration. It's about trust. It's about respect and working together so that we can actually build this health system so that patients don't have to walk the long journeys to be turned away, that we can provide through collaboration the treatment and the supplies to do safe surgery.
I remember reading a while ago, I forget some of the details of it, but it was talking about general poverty in the world and how just looking at a country like India, as you mentioned, there could be a number of Einstein equivalents just waiting to be exposed, but they can't because they don't have access to basic food and nutrients and education and the ability to allow their skills to flourish. So it's lovely to see that in addition to doing the cleft surgery, the ability of empowering kids to have a better life is something that could really have a large and meaningful impact to the rest of us.
That's our hope and our dreams, right? So long after we're here, we really do want safe care, no matter what surgery is being done, that safe surgery can happen, throughout the world. And Operation Smile can play its part to bring those incredible providers, to partner with local providers to elevate that health system.
So I'm hoping you could share maybe some tips. Let's imagine, for example, there's a smaller nonprofit out there listening that is drooling at the fact of having all these partnerships, of having such an impact. What would be some high level, maybe 3, 4, or 5, whatever number of tips you can come up with, or considerations that they should think of when they're trying to take their nonprofit to the next level?
Sure. I would say that one of the biggest things that Operation Smile over 42 years has learned is that cross-sector collaboration is so important. We can play our part as an organization, but if you don't find that other partner that has similar core values and similar values than you, it's going to be hard to do it alone. So we've always tried to partner, even with the hospitals. And as an organization, we always made sure that it was, locally led, and I talk about it as a different gears. So for those nonprofits out there that are working on a global scale, make sure that it's locally driven and that they've bought into it, because they're the ones that are doing it day in and day out. I would also say working with partnerships, finding that right global company or local company that also fits your core values, that you can create, I call it a win-win. How do you help that company, but they also help you in return? I would also say build relationships on trust and respect. This organization has grown a lot, and we've learned a lot over 42 years. And what we've learned is if we really believe in our passion and stick to what our core values are, which is compassion, resilience, impact, it's really what drives us every single day. And then make sure your employees find purpose and understand, and really are committed to the work that you do. So that we say it's a lifestyle at Operation Smile, it's not a job. And we really want people to feel that every single day. And when they come to work or not at work, that their purpose in life is really met and continues to drive them day in and day out.
Lifestyle instead of a job. I like that one. I might quote you on that. So for people who aren't in a position to be a partner, or maybe want to donate or try to volunteer some of their time, how can people get involved in Operation Smile?
Sure. I mean, our organization, you can go to our website, operationsmile.org. There are so many ways to get involved. If you're a student, we'd love for you to start a student club within your community. There's ways you can see that on our website. We have about 12,000 students globally around the world. If you're an employee at a company and something touches you today, please reach out. We would love to help you build an employee engagement program within your company. And I would say anybody who's in the digital technology space, there's this really cool thing that happened to us recently. And just one example of how someone was touched by this organization and allowed it to be, so much bigger. So there was a guy who grew up in Guadalajara, in Mexico. And he happened to actually be recently working with Mr. Beast Philanthropy. And they were looking for a charity around surgery and cleft lip and cleft palate. And Oz, this incredible human, remembered the work of Operation Smile when he grew up in Guadalajara. And so Mr. Beast reached out to us, which was incredible. And right now, we've had about 20 million people view our video with Mr. Beast that happened in Mexico. So I think about one individual who was touched at a young age, who really has made a difference. And now, 20 million people really understand the work of Operation Smile. So I would just say medical volunteers are always needed globally around the world. We need educators, we need students to help us drive because they are our next leaders. Corporations can do things at a bigger level. From a digital innovation marketing side, we're always in need of creative ideas of how we're going to tell our story. So if you're touched by the work that we do, and if you feel a connection, please reach out, because we're always looking for people to be a part of this journey. We always say that, ensuring that every child, regardless of the geography, receives the care they deserve. And so as an organization, we welcome ideas and innovative ideas to drive this organization forward.
Awesome. So is there another way to reach you, or is the best way through your main website?
Through our main website, or, my email is Kristie, Kristie, P as in Paul, @operationsmile.org. You can also reach out to me.
Awesome. Christy, thank you so much for joining me today and sharing all this news. And
yeah, thank you, Alex. Appreciate it.
Thank you for doing this awesome work. We really appreciate it.
Yes, thank you. Thank you, everybody. Appreciate it.
All right, that's it for today. I'm Alexander Lapa, and I hope you join me again in the next Agents of Nonprofit.